Hi everyone, so today we are talking about the cardiac inotrope group of medications. Traditionally, these are life-saving drugs that are usually given in a coronary care unit or an intensive care unit. So you would need a central line or a long line that goes right up your arm and right to your heart. Not quite into the heart, but close, so that the drugs can be delivered more centrally, not out in the veins, where they can hurt the veins and cause other issues. These drugs, for very good reason, are only given to very sick patients. They are generally done in an environment where the patient can be very closely monitored by a specialist unit, by specialist doctors and specialist nurses who are trained to look for the acute effects of these drugs. And as cardiologists, as heart failure specialists, we will use them particularly in patients who are really struggling with their heart failure and need hospitalisation and need something that's really going to help turn things around. They are particularly valuable in patients who've got borderline or low blood pressure and a lot of fluid loading and limitations where the usual standard drugs aren't going to be able to get rid of that excess fluid. They're going to cause worsening low blood pressure, maybe worsening kidney function. And so in order to turn this around, we would use these special inotropic medications by infusion. Now, obviously that means that you're going to be stuck in hospital for maybe many days, and that might be necessary. These would then hopefully allow in time us to turn things around and then re-establish medical therapy with tablets that hopefully you can then go home with. So why I'm kind of a bit excited about this one is that finally we have a tablet drug that has been approved that is a cardiac inotrope. The other medications that we have in heart failure aren't really specifically designed to increase the contractility of the heart muscle. They do improve dynamics of heart function in heart failure, but they don't do it by actually causing increased squeezing of the heart muscle. They do it in other ways, which we've already discussed. So the new drug that is now available, at least in Australia, and I'm sure in the US and probably in Europe and the UK, and probably in New Zealand, is a drug called either Vericiguat or Riociguat. These drugs, as I said, are for quite sick patients, class 3 to class 4 heart failure. So just to recap, those are patients who are short of breath on, say, changing their clothes, showering, bending forward, tying their shoelaces, maybe trying to elevate their arms to brush their hair or blow dry their hair if they're female or male, I guess. I'm sorry. So fairly minimal exertion tolerance, or they may have even class 4 heart failure symptoms, so breathlessness at rest. Now, they do, under at least Australian guidelines, have to be stabilised first in hospital, and then once they are a bit more stable, then they potentially qualify for this medication that's given via tablet. So I've now got a number of patients on this drug, and they were all very sick. They were in hospital. They are now free of hospitalisation, which is fantastic, and for quite some months. And they're all actually doing quite well on it. So I'm pretty thrilled with how it's going so far. But they have to be fairly cautiously introduced, and they can't be given to patients who've got exceptionally low blood pressure at the time. But if you're able to stabilise the blood pressure and have it sit around 100 plus, then there's a good chance that you'll qualify for this drug. So the main concern about it is the potential for lowering blood pressure. it does have to be monitored by a cardiologist, preferably heart failure specialist, but cardiologist, at least in this country. So each country obviously has its own specifics around that, but it's certainly something you can ask about. How does this work? Well, it works by increasing the effectiveness and availability of a substance called nitric oxide, which we already have in our bodies, but this drug helps augment it, particularly in the heart and the blood vessels. The nitric oxide can relax blood vessels. That's why it can lower blood pressure. It can reduce the resistance, therefore, to blood flow being pumped around the heart, and therefore improve cardiac output, which is the heart pumping ability. While these drugs don't specifically prolong life, they can certainly be life-saving. They can be literally life-stabilising, and then once established, they can reduce the need for recurrent hospitalizations from heart failure, which is really, really very important. I think as a heart failure patient, you want to feel well, you want to stay out of hospital. You don't want to be in hospital all the time, tied up to lines and having you stuck every day, and not being with your family, not being with your friends. That pretty well isn't great. So anything that can help you actually stay free of hospitalization, I think, is fantastic. But you also want to feel better. You want to actually get to a point where you can really thrive and do the things that you want to do, whether that's with family or friends or on your own. But life is about living it, not just surviving. Sometimes all we can do is just try and survive until we can get to a point where we can actually start really living again and thriving. That is my hope for you all. We want to see patients who are thriving, even if they have heart failure. The cardiomyopathy or weakness of the heart muscle does not have to mean that you have to be sick and in hospital. You can be well, and in fact these days with the drugs we've got, you can be well for a significantly long time, free of hospitalization, free of heart events, well enough to do the things that are important to you. I've certainly seen patients get back to life, get back to work, get back to family, get back to exercise, and totally brings me joy. So my wish for you is that that's your path, and what I would like to do here is help you learn about how you can do that, help you reach it. Even if all that is to inform you of what's out there and what it is and why it's there and why you should do it, then that's a win. So take care, everyone. Remember, you have any questions, you ask your doctor. This information is for education purposes only. I don't know you specifically, so I can't advise you medically. But your doctors can, and that's what they're there for. My job is to help educate you. I'm happy to do that for as many people as I can possibly reach. And so to help me reach those people, please like and subscribe if you found this of value, and share it, pass it on, so that more people can learn about what they can do for themselves for heart failure, and what are all those things that, all those words, all those things that are challenging to understand. And I'm hoping that I can deliver this information in a way that reaches you and helps you. So take care out there, and let's make this year a great year. Stay safe, and I look forward to speaking to you next time.